The effects of radiation on tissue. The 5 R's of radiotherapy. Welcome to our discussion on the fascinating and complex effects of radiation on tissue, with a focus on the foundational principles known as the 5 R's of radiotherapy. Today, we will explore how radiation interacts with living cells and why these principles are at the heart of modern cancer treatment. Let us begin by understanding the fundamental action of radiation on tissue. The biological impact of radiation is driven by the ionization of atoms within cells. This process is primarily responsible for damaging deoxyribonucleic acid, or DNA, which is essential for cellular function and replication. There are two main mechanisms by which radiation inflicts damage: direct action and indirect action. Direct action occurs when radiation particles strike and break the DNA strand directly. This is most common with high linear energy transfer radiation types, such as alpha particles and neutrons. However, in clinical settings, particularly with X-ray therapy, the indirect action is far more prevalent. In this process, radiation interacts with water molecules within the cell. Remember that water comprises nearly 80% of cellular content, resulting in the production of highly reactive free radicals. These free radicals migrate to the DNA and cause further breaks and damage. The damage to DNA can manifest in several ways. First, cells may die, becoming incapable of division or function, which is precisely the objective when targeting cancer cells. Second, mutations can occur if the cell repairs its DNA incorrectly, increasing the risk of future cancer. Third, some cells may successfully repair the damage and continue to function normally. The sensitivity of a cell to radiation depends on its rate of division and its level of specialization. This concept is rooted in the law of Bergonié and Tribando, established in 1906, which states that cells are most sensitive to radiation when they are undifferentiated, divide rapidly, and possess a high mitotic rate. This explains why cancer cells, which are typically less differentiated and divide frequently, are generally more susceptible to radiation than surrounding normal tissues. Let us now turn to the 5 R's of radiotherapy, which represent the critical biological factors that determine how tissues respond to fractionated radiotherapy, that is, treatment delivered in multiple, smaller doses over time. These principles allow clinicians to maximize the destruction of tumor cells while minimizing harm to normal tissues. The first principle is repair. This refers to the ability of cells to mend sublethal DNA damage between doses of radiation. Normal cells are equipped with efficient repair mechanisms, so by dividing the total radiation dose into many small fractions, typically administered daily, normal tissues have the opportunity to recover before the next exposure. Tumor cells, on the other hand, often possess defective repair systems, making them less capable of recovery and more vulnerable to repeated doses. The second principle is redistribution. Cells exhibit varying sensitivity to radiation depending on their position in the cell cycle. They are most susceptible during the G2 and mitotic phases, and most resistant during the late synthesis phase. After an initial dose, the population of surviving cells often becomes synchronized in the more resistant phases. Over the interval before the next dose, these cells progress through the cell cycle and redistribute into more sensitive phases, increasing the effectiveness of subsequent treatments. Third, we have reoxygenation. Within a tumor, cells that are deprived of oxygen are 2 to 3 times more resistant to radiation than those with ample oxygen. Oxygen enhances the permanence of free radical damage, making radiation more effective. After the initial dose, the better oxygenated cells, typically on the tumor's periphery, are killed, leaving behind more resistant hypoxic cells. However, as the tumor shrinks and blood flow improves between treatments, previously hypoxic cells can become reoxygenated, and thus more sensitive to further radiation. The fourth principle is repopulation. Both normal and tumor tissues may accelerate their rate of cell division after radiation exposure to compensate for cell loss. For normal tissues, this accelerated growth is protective and promotes healing. For tumors, however, this presents a challenge, as rapid repopulation can undermine the effectiveness of therapy, particularly if there are delays or breaks in treatment. To minimize this risk, it is essential to maintain a consistent treatment schedule. Finally, we arrive at radiosensitivity, the fifth principle. This refers to the inherent sensitivity of a particular cell type or tumor to radiation, which is determined by its genetics, biochemistry, and capacity to manage oxidative stress. Radiosensitivity varies widely among different tumors. For example, lymphomas are highly sensitive to radiation, whereas glioblastomas and melanomas tend to be more resistant. Recognizing the radiosensitivity of a tumor helps clinicians select the optimal total dose and fractionation schedule. The other 4 principles can further modify this intrinsic sensitivity throughout the course of treatment. In summary, the effects of radiation on tissue result from a complex interplay of physics and biology. While the initial damage is initiated by breakage of DNA, the ultimate outcome, whether a tissue heals or is destroyed, depends on dynamic processes described by the 5 Rs of radiotherapy. Modern techniques in radiation therapy are designed to concentrate the dose on the tumor, yet the fractionation schedules used are fundamentally based on leveraging these biological principles to achieve the best possible outcome for patients. Thank you for joining this deep dive into the science of radiation effects on tissue. Stay tuned for more insightful discussions on advances in medical science and cancer therapy. It's the Everything Surgery Podcast. Dissect the extraordinary.